How about a little actionable content, shall we? 80% of incurable headaches caused by cervical spine. Caused by cervical spine. That kind of sounds a little bit weird, right? Because the cervical spine is actually, biology, right? It's an anatomy of the human body. It's caused by an infraction, inflammation, and an impingement within the cervical spine. But caused by the cervical spine, well, your head staying upright and everything functioning, and your spinal column not being severed is also caused by your cervical spine. But there are, for safe, do it yourself remedies. So might as well capitalize on that, shall we? And you know what? Hey, every once in a while, I'll get a headache. Like my diet will be on point, my hydration will be on point, but then I'll just get like, something seems a little bit goofy. Things are getting a little bit too stiff in the old neckaroonie, and you get a little bit of a headache. Now, is it in the front? Is it in the back? Is it all the way around your head? Okay, depending on what it is, well, maybe you can just figure it out by making sure that your neck is nice and loose and operating properly. So, if you can do it from the comfort of your own home without any risk to yourself, without having to pay out hundreds of dollars to what you have there in the comment section right there. Oh, why don't you just say if I had a good chiropractor? Because, maybe not everybody lives in a metropolis like you do. Okay, maybe not everybody has access to a chiropractor. Maybe somebody doesn't want to go to the chiropractor. Okay, maybe somebody doesn't have the funds to go to a chiropractor. Maybe you can just, do it yourself and figure it out that way so that you're constantly in control of your own health and well-being. Seems appropriate, seems helpful. Symptoms of a headache and trigeminal neuralgia. That's a word. A chronic pain condition affecting the fifth cranial nerve are more than vexing. Some people have mild headaches, which can be relieved with some rest. For those with severe headaches, they may not have only suffer from dizziness, but they may even vomit. Trigeminal neuralgia, there it is also known as the number one pain in the world. I would have thought that would have been just a nagging wife. The usual treatment for pain is taking painkillers. Oh, yes. Oh, it hurts so bad and my shoes fell off, which can provide temporary relief. However, if painkiller dependency develops, even the dosage is increased. It will eventually become ineffective. Dr. Gua Bin Wu, sorry to hear about that, director of the Jiantang, a traditional Chinese medical clinic in Taiwan, believes that the key to most headaches and trigeminal neuralgia lies in the cervical spine. And he has shared with us several treatment methods that can quickly relieve headaches and TN. Just going to call it TN. Don't need to stagger around it. Don't need to butcher that any longer. So 80% of incurable headaches and migraines caused by cervical spine misalignment. Thank you. Thank you for giving us proper context on this stuff, okay? Most of your headaches is caused by having a head. How do you cure that? Well, the French had a solution for that in the late 1700s, but it's not exactly as clean or helpful as you might hope. One cause of headaches is not easily noticed, and it's cervical spine misalignment. Many patients of Dr. Wu's, who's those who have developed incurable headaches and dizziness after an event like car accidents, but whose brain and cervical spine examination results with Western medicine techniques appear to be normal. However, sometimes there are clinical errors in the diagnoses. If the cervical spine is only a slightly crooked, X-rays, computed tomography, and magnetic resonance imaging may not necessarily show it. In fact, according to Dr. Wu's clinical experience, more than 80% of people with chronic migraine have cervical misalignment. In particular, the misalignment is the first and second vertebrae of the cervical spine, which compresses the blood vessels entering the brain from the neck, creating a blood circulation disorder. In addition, it can also compress the nerve bundles, causing abnormal signals to be transmitted to the brain and resulting in headaches. Therefore, the key to treating headaches lies in the adjustment of the cervical spine. Cool. So, let's figure out the causes and the symptoms of TN. Western medicine has classified 10 pain levels, and TN belongs in levels 9 to 10. Holy, which is no less than labor pain. Oh my God, what women most affected when it comes to headaches. We understand. You're normally the cause anyways. Therefore, TN is also known as the #1 pain in the world. Well, that and some weird spider bites or, different bug bites as well. What are those wasps called that, bite you and people think that they get past, pain examples? That was all the thing on YouTube years ago. Anyways, the TN, Trigeminal nerves are the fifth pair of brain nerves, one on each side of the cheek, and they're mainly responsible for the sensations of the face and the motor function of the muscles associated with the chewing movements. As its name implies, the trigeminal nerves has 3 branches. Yeah, tri meaning 3, geminial meaning it likes shiny rocks. The ophthalmic nerve, distributed in the orbital area, makes sense. Maxillary nerve, distributed in the upper jawbone, and the mandibular nerve, distributed around the lower row of teeth, like your mandible, like your jawbone. Go figure. Although it is difficult to differentiate TN from regular toothaches, there are some signs that it can be used to detect TN, such as the nature and the duration of the pain. In the case of tooth decay and tooth nerve twitching, the pain tends to be relatively consistent with a long duration, lasting half a day or 1 day. TN, on the other hand, is characterized by a type of pain that feels like an electrical shock, needle prick, cut, tear, or even a burning sensation, and it is short-lived and sudden, usually disappearing after a few seconds. It is like a sudden electrical shock without warning. Western medicine classifies TN as either primary or secondary. Primary TN is almost always of unknown origin, while secondary TN may be caused by tumors. It's not a tumor. Aneurysms or vascular malformations, which compress the trigeminal nerves. Okay, so that's where everything can hurt. Now let's get into the methods, the cure methods, as it were. Massaging the Feng Qi, Hamini, and Wangu acupuncture points. I didn't pronounce any of those right, but you got the gist of it, right? We'll at least point out which points they are anyways. The 2 Feng Qi points, okay, located behind the earlobes towards the top of the neck and the base of the skull, in the depression just lateral to the thick tendons of the trapezius muscles. Okay, so these boys back here, interesting. The Anemian points, okay, located on both sides of the neck, just behind the earlobes. Interesting. Okay, is that where? Oh, okay. Yeah, I can see that. That juts out. That makes my Native American impression a lot better. It's still a quarter, anyways. So yeah, it's fine. Behind and slightly above the bony feeling protuberance of the mastoid process. Yeah, no, exactly. That's legitimately those ones that kind of feel a little bit like cables in the side of your neck. And then the Wangu points, located in the depression posterior and inferior to the mastoid process. So that's a little bit deeper behind those. Interesting. Raise your hands behind your head. Okay. Oh yeah, those boys. Yeah, way back there. Thank gosh, there's a picture of it right there, because it'd be tough for me to read, and I don't really have a reflective surface that properly allows me to read what's going on screen. At least there's a nice demonstrative that's right there. You can use your thumbs to clasp your acupuncture points and then shake your head with force. Sweet. So, wait. Now it's all right to shake somebody, okay, if they're older, but if you shake a kid, you go to jail. Oh, okay, I see how everything goes now. This is a better dynamic therapy, as the bones may return to their original position during the shaking process. A neck massage. Oh, okay, cool. And kneading the neck muscles. Okay, with the palm of your hand across the back of your neck, use 4 fingers and knead the neck muscles. Then switch hands. During the kneading process, you will find a certain spot to be most painful. This is the place where cervical spine is misaligned. By relaxing the muscles here, your headache will be much relieved. Low head turning. All right. Your upper body should be as flat and bent low as possible, with your head stretching outward. Okay, so jutting your head forward, and then the emphasis on your cervical spine being parallel to the ground. Holy, that's a lot of stretching. Next, Your neck can move slowly in any direction, nodding and shaking and or stretching. Suppose your neck moves to a certain angle, you find a spot where your neck gets stuck or it is quite painful. Then let your neck pause there for 10 seconds. So it's kind of like stretching any other muscle that's inside the body. You just need to be a little bit more careful. It's not like you're going to, cause paralysis in yourself, and nothing too terribly long lasting. This is ultimately the function of your body, so if you're not doing anything terribly disruptive to it. So just think of a stretch, okay? Like if you're doing a pec stretch or a tricep stretch, you go as far until you start to feel a pull in the certain muscle area. Do that, but with your neck this time around. Sounds a little extreme, but that's the way you need to do it. Then turn your neck outward a little bit more. Pause again for another 10 seconds. The joints will be pulled apart a little bit more. Repeat this movement about 3 times and the stuck joint will open up. You can also lie on your stomach with your elbows and forearms propped up on the bed and do this a slow head turning technique. Of course, you can do a lot of things as well. Union Jack head turning. Oh, okay, cool. Like, you know how it kind of has the St. George's cross on it, and then it's got the additional lines on it as well. Move your head along those lines as well, okay? It's kind of like a D-pad on a controller as well. The exact same thing, really. Union Jack, or if you were born after, during, or after the 1980s, like you're old. The way that a Super Nintendo controller can move. The method is drawn like the Union Jack of our head. Repeat the following steps 5 times each. Look right, look left, look up, look down, downward left, downward right, upward left. There you go. Repeat as necessary. Turn your head 45 degrees upwards to the left, stretch to the limit, push it to the limit. Then turn your head 45 degrees upward to the right, stretch to the limit. I'll just stop. And then back again to the center, then to the left, then to the right, then up, then down. Slowly turn your head 45 degrees to the left, to the center, then to the right. Do all of that, repeat as necessary. 5 times it says if you're just starting, if you just need to break in your neck. Well, not like that though. That could be terrible, okay? Do it a couple of times. Do it a couple of times until you feel a little bit of relief, and then you can repeat it whenever you'd like to throughout the day. Whenever you think about it, and then you can just loosen it up. So if you have any headaches or if you just have a tight neck, hopefully those skills, hopefully those techniques will help you out. If you want the access to the demonstratives, I'll link the article in the description down below. But until then, with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.